The big concern is with pregnant women. For other people, this virus has very little impact. So 4 out of 5 people who get infected with this virus are actually totally asymptomatic. They don't even know that they had illness. And then the other 1 out of 5 people generally has a relatively mild disease characterized by some headache, rash, fevers, and then some muscle and joint pain, and then sometimes some redness around the eyes. This typically runs its course over a few days to maybe as long as a week or so, and then goes away. The real concern comes with the developing fetus, and so pregnant women are obviously very, very concerned about this. And in the United States now, we have no transmission of this virus. So anybody who's going off this weekend and taking off to other areas of the country, there's really no concern about mosquito-spread Zika virus. If you're going to one of those areas, such as the Caribbean or South America, where there's a spread of the virus, you do have to be concerned.
We assume that first trimester risk is always the highest for the fetus, but it doesn't really appear that that may be true with Zika virus. It appears that it could be affecting fetuses in the second and maybe even the early 3rd trimester. So exactly the timing that the effect is the worst, we're not certain of. We also know that it is transmitted from sexual partners. That's been documented through the CDC with travel also, and so we want pregnant women or women who are trying to conceive to be careful around with their partner's travel also around the issue of whether or not they could get infected. In the United States, the risk is probably minimal at this point because we don't have any reported incidents of local transmission, and all of it is travel related. But from the standpoint of mosquito risk, it is wearing clothing that protects you from mosquito bites, so long sleeves, long legged pants, and then using clothing if you're in high areas with a lot of mosquitoes that are infused with insect repellent. Insect repellents that are appropriate to be used during pregnancy, and staying as much as possible in areas that are air conditioned with screens.
That this is a relatively fluid situation, that we don't know everything there is to know about this virus, even though it's been around for decades that we have described it. We clearly have still some questions that need to be answered. So as Dr. Berg related, the absolute risk to a woman who is pregnant and gets infected with this virus is not known. It is significant, however. I've seen statistics anywhere from 1% to as high as 20% may develop microcephaly. There's also probably a spectrum of fetal abnormalities that go along with this infection. So everything from the most severe case of microcephaly to perhaps much more mild fetal abnormalities. Well, we think that conditions in the United States will not be nearly as predisposed towards transmission of Zika virus. There are differences in the public health infrastructure. There's differences in many of our communities with regard to living in better housing with screens that are intact, living with air conditioning. So mosquito-borne diseases we think will typically not be as severe here as they are in other parts of the world. Clearly, there are some common sense things that people can do. And in our area, we're obviously much more concerned about West Nile virus, for instance, than we would about Zika virus at the present time. West Nile virus has devastating complications in normal adults, and so this is something that people do need to be concerned about and take those precautions. So wearing some loose, cool, long sleeve, long legged clothing, Using mosquito repellents, my understanding is if used by the label that's approved by the EPA and the FDA, that all of these repellents are safe for use in all adults. So I would say that using those precautions to prevent mosquito-borne and tick-borne disease is really the watchword. The message really needs to be a measured tone of concern that local transmission of this virus is not being seen, is likely not to be a real problem here in Nebraska, that there are reasons that you should take precautions against mosquito-borne disease and tick-borne disease here as we enter the summer, and I think that's something that should be emphasized. And then if you are pregnant or are trying to conceive, this is of concern, particularly if you're going to travel to an area where it's being spread or your partner has gone to those areas. Clearly, the message from this needs to be prudent use of antibiotics for all of us. So if you don't need an antibiotic, you have an upper respiratory infection, a sore throat, something that an antibiotic won't treat, don't take it. And then again, using antibiotics prudently, so the right dose for the right period of time to try to treat the infection but not to increase the selective pressure. And then one of the things that we're really concerned about with this colistin organism, or colistin resistance trait that's been described, is that it's been seen in food animals and in the environment. And it probably indicates use of antibiotics in our animal husbandry, in our agricultural practices that we need to try to get away from as much as possible. And so clearly we need to have a multi-pronged attack on antibiotic resistance in general. So we need to emphasize drug discovery, and a lot of the pharmaceutical companies are not as interested in antibiotic development because these are drugs that are used for short periods of time. They aren't as profitable as other drugs. So we need to, as a society, incent companies to get back into drug discovery. When we discover those drugs, we need to use them very prudently throughout medical use. We need to, when resistance occurs, because it will, this is kind of a natural phenomenon that when you put selective pressure on bacteria, they respond by becoming resistant. So when we discover a drug and we use it, eventually we will see resistance. That's been seen over and over again. In those instances, we need to put into place very good, effective infection control measures so that we're not spreading it from person to person. And then we need to take a global view of things. So agricultural use of antibiotics, antibiotic use in the third world, we're all interconnected. This is a great example of that. So this colistin organism, resistant organism being described first in China, now is being seen everywhere.